So when the reason for the extended lymphadenectomy has actually come with a landmark paper by Akiyama et al. They have shown that in their patients with thoracic esophageal squamous cell carcinoma with a 2-field and 3-field, they have shown that up to 30% they have cervical lymph node involvement in these 30%, and also overall survival they have shown to be significantly different in 2-field and 3-field. This is another paper where they have shown that with 3-field they have shown that there is a stage migration in almost 20% of the cases, and with not much of difference in the post-operative complications. And this is another one where the study where there is a meta-analysis. They have shown there is trend improved survival rates with 3-field lymphadenectomy when compared to the 2-field. And here also they said there is not much difference in the post-operative complications. And again, there are studies which have shown that the oncological, the recurrence rates with the 3-field lymphadenectomy are shown to be significantly less. You can see that in a study by Nishikara and all that, they have shown that the recurrence rates is about 13% and 24% when you take 2-field and 3-field lymphadenectomies. So, but there are studies which are also against 3-field lymphadenectomy, like there are the RCT which is there in thoracic journal. There they have shown that there is not much of improvement in the overall survival or disease-free survival, and they also showed that there is some complication rates which are involved with the 3-field lymphadenectomy. This is another recently published study where they have shown that they have compared with 3 arms where they have done 2-field and 3-field. Like 3-field they have done for all the patients who have right recurrent laryngeal node positive, and then without positive, then they had 2-field lymph node, and they have analyzed the results. And in that, they have said that there is no additional cervical lymphadenectomy can be avoided in patients with middle and lower thoracic esophagus and with negative recurrent laryngeal node by frozen section. So, but all these, the positive effects of 3-field lymphadenectomy comes with more complications like anastomotic leak and recurrent laryngeal nerve palsies when compared to the 2-field. It's quite high. And so basically, what a surgeon can do for this lymphadenectomy, like you know that a 2-field lymphadenectomy is a standard one. It should be followed for each and every case. That's a must. That's a minimum that you have to offer for all the patients. And then 3-field lymphadenectomy can be considered for patients with upper esophageal tumors with the cervical lymph node involvement, and the lower thoracic 2-field lymphadenectomy is enough. And the middle thoracic comes to where we have a little bit of controversy for that. And if you have a suspicious lymph nodes preoperatively, either clinical or imaging, then these are the cases where you can go for the 3-field lymphadenectomy, or we can do a right recurrent laryngeal lymph node sampling intraoperatively, and then based on this positivity, we can either proceed with 3-field or 2-field. Thank you.